back to Swasthya. In this new season, Aram, we are going to talk about important topics like MPH, MHA, and job opportunities. I am your host, Dr. Palak Majmudar, and I'm thrilled to kick things off today. It's my pleasure to introduce our guest, Dr. Somen Saha, a renowned expert in the field of public health. Dr. Somen Saha, a professor in Indian Institute of Public Health, Gandhinagar. His work areas include health financing and health systems in convergence. Dr. Somen Sir holds dual masters in public health, University of North Carolina at Chapel Hill, and health management, Indian Institute of Health Management Research. It will take whole another podcast to list your accolades, sir. So let's head to our podcast. And to know more about him, you can head to our official website, IIPHG's official website, and know more about him. So it's lovely to have you here, sir, today. So let's dive into the world of public health. So starting off with the most important question, yet a very difficult question, what exactly is public health?
Well, Palak, this is indeed a difficult question. So there are different definitions of public health, but let's try to unplug it and talk about, so when a physician, examines or analyzes his or her patient, it is essentially individual health. Public health is when we deal with population in total, and we talk about people, their conditions, determinants, and when a condition affects the population at large, that is an issue of public health importance. And latest example, if you want to take it, is like, COVID-19 pandemic that anybody could have relate with, because we have experienced things which we have not experienced before, like national lockdown, the pandemic, and, everything standing still. That's essentially what is public health. And the response to that pandemic in terms of expanding PPE kits, Make in India, which has boosted productions, vaccinations, personal protective equipment, masks, social distancing, all these are responses that are of public health importance. So something that people can relate with, and that is what is public health. Yep.
All right. So that leads me to my another question, that what public health professionals actually do.
Yep. So public health professionals' role are multiple. It can go from determining what is the problem, also determining why such problems are happening, analyzing data to understand, is this problem a routine affair, in which case we call it an endemic issue. Is this something which goes against the routine trend, in which case it can be called an epidemic, or if there is a wide scale trends which are changing, any outbreaks which are happening, and then mitigating those things. Mitigating through public health response, which can include providing additional funds, which can include providing materials, which might include also providing facilities, making facilities compliant so that they can mitigate those risks. So it's essentially about risk reduction for issues that affects our general population that public health professionals primarily deal with. And as I said, it is multifactorial. So public health, while there are health and family welfare department, but if you go look into depth of it, every department, there are like, women and child development department that has to deal with public health. Education department that has to deal with public health care of these students who are undergoing the programs, the schoolings. So it basically encompasses multifactorial issues to understand why such problems is happening. Public health can also deal with the societal issue. What are the societal factors? What are the determinants which defines why some problem is happening? Right. So this all are issues which a public health professional typically deals with.
That's a very crisp answer to all our listeners and aspiring students. I hope it clears a lot of your doubts and gives you an insight to what actually public health is and what you will be doing next. So, I would like to ask you, what is the eligibility criteria to enroll into Masters in Public Health course?
Yeah. So Masters in Public Health is one course which trains a graduate to understand and excel in this world of public health response and determinants of diseases. The eligibility criteria at Indian Institute of Public Health, Gandhinagar, are primarily any graduates who has got a certain marks and who are interested to learn, who to explore this world of public health programs. So essentially all masters who have done 50% or above in the graduations are eligible. Typically in our college, 60% of the students come from medicines or paramedicine background, including Indian system of medicines, Bachelor of Dental Surgeries, Bachelors of Ayush, Bachelors of Homeopathic Medicines, and other systems of medicine, physiotherapies, paramedical, paraclinical disciplines, and many other such paramedical disciplines comprises. But, if you look into this, and as I said, public health is multidisciplinary. So if you have to deal with the legal aspects of it, you need someone who has got interest with either the law. If you need about communication, you need someone who has got interest in, say, journalism. We have had students in the past who have come from journalism background who has gone and done excellent work in the area of health communication. Public health might include people from statistics who might want to excel in the area of data analytics. Public health can include a lot of, if you want to work on standard treatment guidelines, so your knowledge about medicines, disease surveillance outbreaks. So this is where your medical degrees will be of help. So, and, MPH program typically across institutions are typically designed to ensure that, the multidisciplinarity of the students are taken care in their educational programs.
Definitely. So it is a very diverse and all-inclusive field. That's what I would like to believe. So let's talk about personal journeys. I would like to know what made you choose public health as your career?
Well, that's a tricky question. For sure, I'm an accidental traveler into this era of into the world of public health. So, post my graduation, when I was looking for different career opportunities, I was a bit confused about which disciplines to look into, whether to go for general management or to select any specialization. That was the time when I got influenced by one of my relatives who introduced me to this entire world of public health, and I did my studies around it. Post my studies, again, I worked with the Indian Institute of Management, Ahmedabad, and there I deep dived into the arena of public health, primarily in health financing, and that was my entry into the world of public health. And then onwards, I have worked very closely with the state of Gujarat government, both not only with the health department but with the women and child development department and education department now, to understand and analyze more closely how can we address public health, not from a particular department of health and family welfare, but also other departments which has got its role in advancing public health in Indian scenario. So I hope I have answered the question that you have posted.
Yes, definitely, sir. It was a very interesting journey of yours. It is a pleasure to know how it went. So, my next question is, what should a young student expect from MPH?
Okay, when you say a young student, that's again a bit of tricky question, Palak, because it depends on what his or her background is, and B, what he or she aims to achieve in her life or in her career. So it's a function of multiple factors. But for sure, there is one common phenomena that is across all students that one should have, is that you should have a fire in your belly. You should be you should be really passionate about public health. You should be able to explain what public health is, not only to a professional, but also to, say, for example, your grandmother. Because sometimes those are the most difficult things. If you are a doctor, you can say to your grandmother, okay, I see patients. If you're an engineer, you can say, I build roads. But if you're a public health, okay, how would you explain public health to your grandmother? No, that's the challenge. So as a young student, if you can take up those challenge and develop yourself, so for that purpose, I think the driving force should not be monetary. The driving force should be the passion to learn about the subject and excel into this area. For sure, you have to be passionate about it. You need to learn. You need to read about what are the current affairs as well as the history of public health, because public health is not a recent phenomenon. If you look into the history of public health, then it started from the typical cholera epidemic in United Kingdom back in the 18th century, when John Snow discovered that the pump of of a particular well was actually the cause of cholera outbreak in London, and that was a great discovery. That the harbinger of public health in some sense. Then even if you look into initially in India, for example, malaria, which is such a huge problem in India, Ronald Ross and his work has helped understand malaria, advanced malaria work. Or for example, diarrhea, which is a typical problem in our South Asian countries. If you walk into the work of Bangladesh, Grameen and BRAC, which has actually helped develop ICDDRB, not Grameen, but ICDDRB, which has actually the work there, which has helped develop ORS as such a simple public health intervention, oral rehydration solution, which helped address the issue of diarrhea. So public health intervention did not come in from big university. Public health intervention can come in from grassroots level. One need to be passionate to learn about the history. And public health is now such a big issue. Whether you like public health or not, you probably know about Ayushman Bharat. You probably know about that there is an insurance, whether you know the name is Pradhan Mantri Jan Arogya Yojana or PMJ, you know that there is certain insurance which covers you up to 5 lakh rupees. So that is what is the, how public health is no longer something which is stigmatized or, something which is, restricted to medical colleges. It's something which is now in the big discussion around it. Okay. And as I said, started that COVID pandemic actually has given a lot of flip to people to understand that, learn about it, and at least be worried, if not be passionate about public health.
Definitely. So everything that falls under the sky actually is also connected to public health, right? All right, fantastic. It sounds like there is a lot to learn. So can you share what the core competencies and skills are taught during the course?
Yes. So there are a set of competencies that any public health graduate need to basically be prepared for. I will not list down every of those competencies which have been, there are 40 list of competencies, but some of the few key competencies that one need to be is A, you need to be analytical. B, you need to develop your communication skills. C, you need to have the administrative acumen, the financial skills for dealing with a public health problem. D, you need to be, you need to be proactive in your decision-making process. So leaderships are the key competencies, team bear, management. These are some of the key competencies, those which are vital for any public health professionals to deal with, because ultimately you are dealing with community. And when you are dealing with community, you are not dealing with, very highly educated, doctors. You sometimes have to deal with politicians. You need to deal with talatis. You need to deal with the auxiliary nurse midwives. And, you need to have the competencies to deal with different types of people. Some of whom may support your program. Some of whom may have some belief systems, and you have to develop competency how to negotiate. There might be conflicts, and you need to deal with those conflicting situations to address public health issues. So all these issues, all these competencies are very well mapped out. And when in any MPH program, essentially are competency driven, and basically train you around those competencies, and all the modules, all the courses are designed according to that.
All right. So it's basically overall development of an individual to work with the society in coherence with various stakeholders.
Right.
Right. So great information. Now let's lighten things up with a rapid fire round. So I'll say a word and you have to say the first word that comes to your mind. Right? So shall we start?
Okay, let me try.
Okay, let's start. So the first word is Masters in Public Health.
MPH.
Disease.
COVID-19.
COVID-19.
Pandemic.
How? Mental health.
Depression.
Wow. Okay, that was that was a fun round. So, thank you, sir, for being such a good sport. Now, let's get back to the serious stuff. What are the different job opportunities available for someone who has pursued Masters in Public Health?
Okay, so public health jobs are diverse. I probably can give you some of my personal examples. So when I was graduating, I graduated in 2002. Then most of the jobs were concentrated in a few bilateral agencies like Adaniya. Some of your audience might not even have heard those terms. Adaniya is the Danish government. Then DFATE, which was by the UK government. So those type of bilateral agencies. Now, with a changing scenario, most of the jobs are, a lot of these roles are taken up by the government. I mean, some of your audience might not be well aware about it, particularly the budding professionals. But there is a huge role opportunities in the government, like the national health missions. There are now emerging areas like, Department of Health Research, which are taking up health technology assessment. These are the various areas. But having said so, a lot of international organizations are still active, like, JSI, Johnston India, Japaigo, to name a few, IHAD. So there is a huge job market, even in the developmental sector. There are a lot of development partners like CARE, Piramal Swast, etc., which are looking for professionals. There are like bilateral agencies still, like USAID being one of the important players. Then there are philanthropic organizations like Bill and Melinda Gates Foundation, which are actively working in the domain of public health. But also now, a lot of emerging domains, to name it two, I think corporate social responsibilities of big corporate houses are spending a huge amount of their CSR money for healthcare. And B, are also a lot of other sectors are working towards public health. Okay, so these are some of the huge job markets which are created. A lot of even the consulting firms like Deloitte, PwC, Pricewaterhouse, Ernst & Young, they are actively engaged and they are working towards public health issues. And a lot of the fundings come from Government of India. To name it just is a classic example. You might not know public health. Your audience might not know public health. But you know that there is an EMRI ambulance, 108 ambulance. So these are essentially health interventions which has made care during emergencies so well accessible. And these are areas that there are a lot of job opportunity, job markets around this sector. These are areas where people can explore. And for sure, institutes like IAPHG and other institutes which offers MPHs, they have collaboration with those agencies so that they can create those environment where people can understand and gain experiences in working in those areas while they are part of the courses as well.
That brings me to my next question. What is there a good placement after completing the degree?
Yes. But I must always say this thing, that placement, a good placement, and when you say good placement, I believe that is there a well-paid placements are always a function of your qualification and your interest and your experience. So a function of your qualification, your interest and your experiences. For sure, our students who has done MPH from IPG, they have got placed in very well paid packages, mostly with bilateral agencies, international organizations, research bodies, and they have been placed with national health missions, and people have been doing great. I would always encourage your audience to go through our website, which has got basically details about where alumni have been placed, because those are important areas And for sure, the market is evolving and expanding. And so there is definitely an exciting opportunities out there.
Right. So thanks a lot, sir, for your valuable insight. Now, regarding the Indian MPH, is it globally recognized?
Well, let's understand what is recognition. Any degrees in India are recognized by the University Grants Commission, which is our parastatal body. Okay. And for sure, the MPH program that is offered at IIPHE is recognized by the United Kingdom, because IIPHE as such university is recognized by UGC. So all our programs are recognized by UGC. MPH is part of government recruitment process of any state government, including Gujarat state government. And many of our students are actually pursuing their PhD in foreign universities. So if this is about pursuing advanced studies like PhD in foreign universities, so many of our students have been pursuing in UK, in US, in Germany, and Canada, and many other, Australia, and many other such countries. For job, mostly even when we advertise job, we do not say MPH from Indian University. We just say Masters in Public Health if relevant. Similarly, having worked in many of the, at least in Australia and US, so I know that they say that MPH. They never say that MPH from US University as far as job is concerned. So both for job as well as for further studies, you will be definitely eligible. And because IIPH's MPH program is recognized by the University Grants Commission of India.
Right. So, sir, I have one question. Is it true that the need for Masters in Public Health professionals in India is more?
Absolutely. There is a huge market, and there are now many colleges are coming up because they can see that there is a market, and there is a big market, and there is a big need to train good professionals. So for sure, the job market is huge. The supplies is less, so this is the right time to be there. It has not gained saturations, and as I said, Government of India and state governments are big players. And with India now in the phase of expanding their public spending in healthcare, so the market will open up more, and there will be more job opportunities created, at least in the foreseeable future, till many of our students would survive.
Right. So, sir, usually the students also have this question, what about the return of investment, the time and energy, and also the finances spent during the course? How does it stack up?
Okay, that's a tricky question, a good question. So, if you look into the way we structure our fees and when you say return on investment, there are many universities in India which has got different fee structure. I can only speak about our return on investment of IIPG graduate. Our fees are designed in such a way that our graduate can pay off the any loan that they would have needed for paying for the fees within 2 years of their employment. So that is how the return on investment is. You'll be able to pay off in 2 years' time to whatever fees you'll be paying here within the.
Oh, that is amazing. That is a really short duration indeed. So that's definitely something to consider. Lastly, what are some of the upcoming fields with good prospects for MPH graduates?
So, AI, artificial intelligence, is one very upcoming field where there are now evolving, because the discipline as such is evolving. So this is one area along with many traditional disciplines like, health financing, health non-communicable diseases, which are again, India is in the active phase of disease transitions from communicable disease to non-communicable disease. But many of the traditional diseases like reproductive child health areas are also flourishing, and they are yet to get saturations. Communicable diseases such as tuberculosis, while India is aiming for elimination of tuberculosis, but it will remain as a problem for some time. Even when we have eliminated, it will still continue to be just like polio has been there for some days back. So there are many such communicable diseases that we are working towards elimination. So there are huge markets, but emerging areas like artificial intelligence will dominate the newer areas. But also the startup India, under the startup India, the startup healthcare would be also some market which is evolving, and it remains to be seen how that market evolve and how the courses are designed to address some of those challenges. But this will remain an emerging areas.
Right. So, sir, what would you describe as the most fun area in public health to work in?
What I would describe as the most fun area to work in. So is it a personal question that you are asking me, or it's a professional question? If it is a personal question, I think teaching is the most fun and the area that I always love to talk with our students. So that is one area that is a personal issue. But, professionally, I would say the most fun area is working with the community where the differences you can make. So, there are two sides of the professionally working with the community, for the community, working with government, trying to influence their policies. Those are both challenge and fun. And when you make those differences, even whatever small it is, that really creates a lot of effect.
Definitely. So fun driven with purpose, right? That's how we can sum it up. So excellent points. As we wrap up, I would like to know, what is your parting advice for the students considering a career in public health?
So my parting advice would be, I think I have said throughout, but I would re-emphasize that own your subject. If you are really interested into it, if you're an accidental traveler, public health traveler like I started, you can be that. But once you have been there, once you have chosen that as your career option, you should invest yourself. Okay, there is no looking back. And invest yourself, read latest development, read about the history, educate yourself with areas where you feel the competencies you are, lacking in some way. Make some additional efforts. Now with, a lot of initiatives such as SWAYAM or mass open access, this is a time when people need to basically develop. We can go for external resources. And for sure, UGC and the Government of India are now making a huge investment on career, and there are a lot of flexibility compared to what we used to have back in our days. So one should make the best use of it, of the time that they are in the colleges, whichever they select. And my only parting advice is that be in an educational institute which has the connection with the public health community. Because ultimately public health is experience driven, and you are better placed in working with an organization, with an academic institute, which is both a research institute, which always maintain those connections with the body, with the community at large.
All right. That was a really insightful and a very substantial session that we had with you, sir, today. So thank you, Dr. Somen Saha, sir, for sharing your expertise and insights with us. Today, it's been a pleasure having you here. And to our listeners, thank you for tuning in. I hope this session was very helpful. I hope it helps you guide you through different situations and helps you decide what to do, where your purpose lies, and how to navigate through it. So that is it. Stay tuned for our next episode. Thank you.
Thank you, Dr.
Stay healthy.